Good morning, everyone, and welcome to Health and Social Services. And we're going to start with the call of the roll.
Councillor Anderson, can you hit your...
We're good. And is there any declarations of interest? Seeing none, we will move along. And approval of the minutes. Councillor Carter, second. Mayor. Councillor Henry. Chair Henry. All in favor? And we will move on to presentations. Dr. Kyle.
So, good morning, Chair and committee members. Delighted to be here today. Before we begin, I just wanted to thank my team, and in particular, Director Jaffer, our Director of Business Affairs, and Chief Cheeseborough, who is the Chief of Paramedic Services, for their inputs into the budget transmittal report and budget. And I want to thank Commissioner Taylor and Director Pincombe for their guidance and support, which has been a fairly long journey to get here. So without further ado, I'm going to turn the lectern, if I've got this right, just hold on here, over to Director Pincombe, who's going to speak to this slide. Thanks.
Good morning, Chair Roy, members of Health and Social Services Committee. I just want to thank you for the opportunity today just to provide some brief introductory remarks to the Health Department budget that's before you this morning. Just echoing some of Dr. Kyle's comments, I wanted to thank him and Zara and the senior leader, Troy, and the senior leadership team of the Health Department for their dedication and collaboration in working with the budget team to get the budget that's before you today for consideration. So the budget is aligned with the region's 5% guideline, and it reflects the significant base pressures that are affecting many of the region's departments. The Public Health Department provides for that ongoing response and recovery of services from the COVID pandemic. And the paramedic budget aligns with the 10-year strategy that was recently approved by this committee and council. Following the deliberation of committee today on the budget, it will be advanced to the Finance and Administration Committee on March the 21st, and then on to Regional Council for March the 29th. I'll turn it back over to Dr. Kyle.
Thanks, Nicole. So in terms of our accomplishments for 2022, they are in two buckets. The first is COVID-19 response, and some of the metrics are shown in the top of the slide. And then in 2022, we began to restore programs. So in response to community needs, you can see some of the metrics in the bottom half of the slide. Of course, we opened our new dental clinic in Oshawa, and that's in the first bullet, second part of the slide. And as you know, we were accredited by Accreditation Canada. So in terms of our proposed budget for 2023, you can see on the left-hand side the pie chart that the proposed expenditures are just north of $142 million. In terms of the main cost centers, you can see on the public health side that's sort of shared evenly between infectious diseases and healthy living, which includes our oral health programs. And on the RDPS side, you can see operations focused largely on 911 response. The pie chart on the right-hand side shows the revenue sources. You can see that just south of 52% comes from provincial investments. I should point out that these are discretionary and conditional grants in law. And just over 42% of the funding comes from the property tax base. So on the public health side of things, a few strategic highlights are shown there. I spoke about the dental health clinic. The last bullet shows that we are budgeting for some additional professional staff to round out the oral health range of services, and these, of course, are subject to 100% provincial funding. At the top, we have funded for a relocation of our breastfeeding clinic that was co-located with the oral health clinic at the Whitby Mall, and we're making provision to relocate that to the Oshawa Centre to be closer to our sexual health clinic there. We're budgeting for temporary staff, both with respect to childhood immunizations and with respect to public health inspections. We are providing support for our health information services. And you can see that we are budgeting for 3 public health inspection inspector positions supporting both infectious diseases and more routine health protection services, primarily in food safety, but also personal services settings. There was a very fulsome review of our paramedic services and financing study at Committee of the Whole. So the new staffing in the first line corresponds with year 1. I guess it would be year 2 of the 10-year service and financing study. You will see that we are also budgeting for 4 new ambulances and 11 replacement ambulances. We are budgeting for replacement of 57 defibrillators, and as you know, there is a corresponding report in our agenda today with respect to the vendor. We're budgeting for land acquisition for a new station in North Durham, and we're also budgeting for preliminary studies for a new station in South Whitby. So in terms of risks and uncertainties, pandemic, COVID-19 continues. We continue to respond. COVID-19 continues to mutate, and what that means in terms of impacts and programs and services remains uncertain, but we, of course, remain prepared to respond as required. We have budgeted for one-time costs. These are both extraordinary costs related to COVID-19, and there usually are a couple of windows to request other one-time only funding. This is discretionary, and we don't know whether at the end of the year we will get what we've requested. We do try to maximize those opportunities. We are budgeting for a base increase on the public health side of 2% and on the paramedic services side of 2.5%. Of course, we don't know what those increases will be until the province lands on its budget, which I believe is expected later this month. Public health modernization continues to be on hold, but if it does go ahead, of course, it may impact our mandate structure and funding. And as you heard in the Committee of the Whole report, attraction, retention of paramedics, coupled with decreasing enrollment in paramedic programs at community colleges is a potential risk, or are potential risks as well. In terms of forecasted pressures, of course, there will be the annualization impacts of new staff in this budget. There's always the possibility of a change in scope of work for public health through either legislative changes or changes to the Ontario Public Health Standards. There are pressures in terms of changing population needs, population growth. In terms of the paramedic services master plan, there are, of course, pressures related to the implementation of the plan. And finally, there are inflationary pressures, labor cost increases, and so forth that have an impact on paramedic services. So, Chair, that's the summary of our budget in brief. Happy to answer any questions. And Chair, if I can't answer them, if I could direct them to my team, I'd appreciate that.
Thank you very much, Dr. Kyle. I have Mayor Carter.
First of all, good morning, Madam Chair. Good morning, Dr. Kyle. First and foremost, can I just take this opportunity to thank you and your staff for the work that you've been able to demonstrate, especially over the past 3 years dealing with COVID-19 and, of course, always the flu clinics and other things that are happening. So thank you very much.
Thank you.
And to paramedic services, I'm really pleased to be able to see the investments made there. You're probably anticipating this question, and I think that it'll be. I've gone through the documentation in regards to the budget itself, and I see that we have priorities and we've got specific areas of risk and pressures and all those kind of things. My question being is, nowhere in here do I see a priority in regards to the opiate strategy under health, and I'm just wondering, could you help me better understand why that wouldn't be a priority in regards to public health or paramedic services, considering the crisis that we're facing?
Yeah, so in terms of our business plans, it doesn't capture all that we do. It is a priority. We will be revisiting and probably revising our opioid response plan. And on the staffing end of things, we invested in mental health and addiction in last year's budget. So that will become, and their impact will be annualized in 2023.
I know that there's a lot of discussion about COVID-19. Do you believe that opiates are on the same level of COVID-19?
I think they're both important health concerns in Durham Region.
And this isn't a criticism, I'm just asking because, in my opinion, I think COVID-19 is continuing, as I heard earlier on, that there are some concerning trends that are still out there. But I'm really worried about the increased use of opiates, and now the fentanyl crisis is now increasing. And we heard something on the weekend in regards to this new drug called Tranq, which is really scary stuff. And I'm just wondering, are you aware of that drug, and are you starting to get concerned as a health, the medical officer in regards to this new drug that seems to be coming out?
So I'm ill-informed about the drug, so I would have to go back and look at that. In terms of mental health and addictions, it is a high priority for us, and a priority for us in 2023 is program restoration. So as we're able to reapply staff from the COVID response to our programs, of course, this is a high priority, and I know it's a priority of council as well.
Thank you very much, Dr. Kyle. My question moving on is there plans in regards to, considering we have a new police chief that will be sworn in on March 24th, I'm wondering if your team is making the opportunity to not only work with the new police chief and his command team in regards to the concern of some of the major issues we're facing in our communities, including the opiate crisis.
Yeah, so we sit at the community safety and well-being table, so that is a point of interaction with the chief and his team. We would do so on the opioid task force, and often when a new chief comes, they reach out, happy to meet with that person, and I'm sure that there is ongoing interaction on the paramedic side on a number of fronts. So I think many tables at which we can interact either with Chief or his or her team.
My last question to you, and again, I appreciate all the work that your team has put into the budget, and there's so many different elements in regards to trying to provide the healthcare services to a growing region. Is there anything in this budget or that is not in this budget that you wish that you could have included in this budget in regards to the challenges that we're facing in our community at this time?
I don't think so. I don't want those words to come back to haunt me. You have to deal with the priorities that you're currently facing. You have to deal with the financial constraints that are placed on us, all departments, by council. And so we've done our best to align our asks with what we think are priorities, some of which I've outlined. And you have to set priorities. So that's what we've tried to do. Oral health, program restoration, COVID-19, and on the paramedic side, of course, 911 and restoring appropriate response times.
Thank you very much, Dr. Kyle. Greatly appreciate the opportunity to ask you questions. Madam Chair, thank you.
Thank you, Mayor Carter. I'm going to actually ask, and it might be either through you or to our CAO, is there a potential that in the upcoming Health and Social Services meeting that we could actually have an update for the new committee to understand with where we're at with the opioid strategy?
Yes.
Good answer. Mayor Foster.
Well, thank you, Madam Chair. There's a weird alignment of stars, and I'm talking about everyone in this room. So I do have highlighted, Mayor Carter and I are on the same page, engage key stakeholders to implement the Durham Region opioid response. Delighted to hear that, yes, we will learn more about that. I don't know if it's Philadelphia. I was reading an article yesterday about Trank, which sounds like more horrible and more awful. So that would a report will be wonderful. I'm gonna shift. So again, a question that I have for you, and I've got more when we get to the report. Where we see efficiencies found in the budget, and we love efficiencies, and we never ask about efficiencies. We never ask where you saved money. We criticize you when you spend more money. Yeah. Are you giving up anything? And this is a different way of asking the same question that Mayor Carter did. In finding those efficiencies, are you giving up things that you would really like to keep? And I know there are financial constraints, and your answer is a wonderful answer, but the reality is, if we continue to produce budgets that are below the level of inflation at some point in time, level of service has to go down, and for health and social services, that could be a very poor outcome. So in terms of things that you've cut to come back in, is there something that you just hated cutting?
I don't think so. We are given a target in the fall, and that is our focus, and that kind of, if you will, drives policy. And I'm not aware of anything that we've had to cut. I think that we have, as I said to Mayor Carter, tried to align, in particular, our investment asks with what we think are real-time priorities. But I'm not aware of any cuts that we've made.
It's a very comforting answer.
I'm looking at Director Jaffer, and she's shaking her head. So no, it's been a very robust process. But once you get a target, that's what you focus on. You look at your priorities, and you align your investment asks with your priorities, and that's what we've done.
Doctor, thank you. Even in a regular year, and Stella, if you're listening, I'm going to be asking you the same question, so you've got a chance to come up with an answer. But during whatever is regular, you are busy and stressed enough during the pandemic. When I say you, I mean all of the staff. Your efforts are truly appreciated. Thank you. Madam Chair, thank you.
Thank you. Any further questions? Seeing none, I do have a couple of questions, and that is about just the struggles for staffing, and especially in the paramedic side, where it's already highlighted with the training of paramedics, but also in our nursing side of with public health. Are we finding struggles, one, with the public health side, and what are we doing with the paramedics in terms of working with the schools to mitigate and encouraging students to come into the profession?
So I'll deal with public health, and Chief Cheeseborough can deal with paramedics. So I think it's fair to say earlier on in the pandemic, there was a disruption in terms of training and certification on the health human resources side of the pipeline, if you will. In the last year or so, I think things are returning to normal. But you need to understand that we're all recovering and we're all competing for limited resources. So in addition to salary and full-time as opposed to temporary positions, of course, there are other things that attract talent to your organization. So I know CSHR is working behind the scenes on policy to try and make the region a more attractive place to come. So, we work together with corporate services and others to make Durham an attractive place, and you continually work at that. So we will have bumps along the way. And if somebody leaves, I can tell you, you don't replace them the next day. It takes a bit of time in terms of process and so forth. And it's part of the beast. But I would say that, and I think I said this in my orientation, that attracting talent, health, human resources is a top priority. I think for all of us, I say health, human resources, talent is a priority for all of us. And we do our part to make Durham an attractive place for attracting the limited pool that's out there. So that would be my response in the public health side of things, and I'll turn it over to Chief Cheeseborough to speak about paramedics.
Thanks, Dr. Kyle. So to update you, Chair Roy, with respects to acquisition of new staff for paramedics, we're actually in a pretty good position right now. We didn't get as many applications as we'd expected for this, but I had an opportunity to meet with Durham College executive directors yesterday, and got a really positive update on their upcoming fall cohort. They're going to be essentially doubling their cohort at Durham College on the paramedic side. So there's going to be a significant number of new positions at the college, which is going to increase the talent opportunities coming out in the future. I made a commitment to the college that we're going to try to enhance our preceptorship opportunities within this municipality, because if people have the opportunity to ride out and learn here, they're more likely to stay as well because they have a taste of the business. So we're going to commit to that as well. So they have about 600 applicants for the new positions in the fall at Durham College. So that's very positive. And we're cautiously optimistic that we're going to start to see a bit of an upward trend on that, and we'll continue to strive to get that, as well as do our ACP training. And that's a bit of a driving factor as well to recruit people, because they see an opportunity to have an employer potentially pay for additional education and training as a very positive thing. So that's a good thing on our behalf as well. So we see that as positive too.
I'm very glad to hear both of that, and I noticed the sign out front as well too, looking for student nurses. But I will say, having worked as in a teaching hospital, the preceptorship, majority of the time, we maintained our students within our like the hospital system that they were trained in. Chair Henry.
Thank you, Chair. And this question is to Dr. Kyle, but I think you'll be sending it to our Chief Paramedic. Dr. Kyle, do we track the number of repeat opiate overdoses to particular individuals? We don't need names, but if they overdose once, they'll tend to possibly overdose more than once. So I'm just trying to get an idea on that challenge.
So you're absolutely correct. I'll turn it over to Chief Cheeseborough.
Yes, thank you for the question through the chair. So we do track the information. We work with the public health opioid side to share the data on a regular basis. We provide, I believe it's weekly updates now with respects to the calls we do. As far as actually identifying an individual and saying we've responded to individual X 5 times, we don't isolate that individual in our weekly tracking, but we do a regular review within our own division and can see their repeat customers. I suspect the opioid team on Dr. Kyle's staff do that as well. But with that, we kind of, unfortunately, it becomes the known entities within the paramedic service. If I do a call today for patient X and Penny does a call for patient X tomorrow, we start to know that that's the individual that we're dealing with. So surprisingly, the repeat number probably isn't as high as you may believe it to be.
Okay, thank you.
For committee members, Chair, we do have a Durham Region Opioids Information System. You can subscribe to it and you get a weekly update. That's what we're referring to. So one of the metrics is calls by paramedic services. So if you had a single individual who had 5 encounters with paramedic services, that would count as 5 rather than 1. So we don't get into that granularity in terms of single patient, numerous calls, to the best of my knowledge.
So just a follow-up question then. Chief, you had mentioned that you do respond to the same individual more than once. Where in the system do we, or is there a way to get that particular individual, knowing that they're repeating their challenges, the proper support, whether it be addiction or mental health counseling? How do we get that individual to the right place? It shouldn't be your paramedic's responsibility to deal with the issue and then you hand it off to the hospital and then you deal with the issue again. When do we get to the point where somebody has to say, look, this person needs help greater than can be provided, and where do we get that individual onto a path of recovery?
So through the chair, we do exactly what you've suggested, Chair Henry. If we transport that individual, because generally speaking, we transport a high number of our opioid overdoses. We probably wouldn't have to because we have the ability to treat them in the field and potentially leave them. But we focus on the I'll call it the gentle treatment to get them stabilized enough that they're not waking up combative, and we transport them to the hospital so they can get the appropriate follow-up there. We pass that information on to the hospital, they become known there, and then the hospital will start the process of making the contacts for potential addiction or mental health counseling. Unfortunately, that's kind of where our hands are tied and we can't go beyond that. We have, unfortunately, confidentiality rules with respects to what we can share with other agencies regarding patient names and that sort of stuff. And that's one of the challenges we get to. But a lot of these individuals have other challenges they're dealing with, and we try to focus on supports through the PCOP team as well. So our family counselor and our PCOP member go out and try to make regular visits to those types of individuals and make contacts with them. And if you can keep that communication lines open, you can encourage the help piece as well, because at the end of the day, you have to get the individual wanting the help as well. But it is a tough struggle, and that's one of the things we do see as a challenge for paramedic services as well.
Okay. Follow-up question, Chair.
Please.
When you say, Chief, that your team, and I appreciate what they do in the field and they treat and release, how many people are they treating and releasing in a month?
Through the chair, I don't have an exact number off the top of my head, but it like I said, it's not very many that we treat and release on the opioid side, because we try not to wake them up. That's, believe it or not, that's what we do. We give them enough medication to keep them breathing comfortably, because sometimes they wake up and they're very combative as well. So we don't want them to be that. So there's very few that we don't transport as a result of this. The challenge we get to is if they've been treated prior to our arrival. As everybody's aware, there's a naloxone program out, and if another individual has given them naloxone prior to our arrival, if we arrive and they are fully awake and lucid and don't want to go to the hospital, we can't force them to go still. So that's the one challenge. I can look up the data for you and get an exact number, but I don't have it off the top of my head.
My concern is that if we treating them and we're releasing them, they're going to go back to their old ways. And Dr. Kyle, and I don't know if you can answer this question. When is it considered enough when an individual goes to the hospital so many times that they're ordered into some kind of program?
You're right, I can't answer that. I don't know.
Okay, thank you.
Anything further? And Dr. Kyle, and to all your team, I want to say thank you very much. Mayor Carter, when he first started speaking just about the work that has been done, especially in the past 3 years in particular, commend everybody in the teamwork that has taken place and look forward to the next 4 years without having to transition and change every single day. And thanks for all your hard work.
Thanks, Chair. I'll pass it on to my team.
I appreciate that. I'm going to call upon Commissioner Danos Papakonstantinou. I stayed up all night practicing. Good morning.
Good morning. Just want to make sure I know what I'm doing here. This way. Okay. Thank you, everyone. Good morning. And before I begin my presentation, I would like to thank also a few people in this room. I'd like to start with Commissioner Taylor and Director Pincombe and our colleagues in the Finance Department for the work that they've done with us to so diligently help us to prepare for this very strong budget. And I'd also like to thank my incredible team, the leaders who are with us in this room today, for leading the work of the Social Services Department to ensure that our staff, our very passionate staff, achieve the outcomes that we intend for them. And I'm going to highlight Director Jonathan Dixon and Manager Curtis Taylor and Manager Tracy Tyner-Kavanaugh for the incredible work they've done to pull this budget package together. And I'd be remiss if I didn't thank this committee for your guidance and support, as well as I've received leading up to this budget. Thank you. I'm pleased to report that the Social Services Department budget before you today is within the approved overall 2023 property tax increase guideline of 5% increase set by Regional Council. Throughout 2022, communities across Durham Region experienced emergencies that required the support services of our emergency social services team. Some examples of interactions included 10 residential fires, 2 immediate community needs involving vulnerable seniors, 1 natural disaster, Ukrainian humanitarian efforts, and an emergency temporary warming center. As you know, the Primary Care Outreach Team, also known as PCOP, is a key partnership between the Health Department's Paramedic Services and our department's Family Services Division. The team provides mobile outreach services from an advanced care paramedic and a social worker working with community partners to deliver services and help individuals connect with community supports. The PCOP team had over 2,900 client interactions in 2022. In addition to the PCOP team, we have a mental health outreach program called MHOP, also providing outreach to those experiencing mental health with addiction support and service navigation. In the first 6 months of the program in 2022, MHOP had 346 client interactions. The Partners Thought Response Program, PAR, funded by the Ministry of the Attorney General's Office, involves group therapy to those charged and convicted of intimate partner violence. The program delivery includes safety planning and support to partners, which totaled 681 individuals throughout 2022. Human trafficking remains a priority, with 80 victims receiving support services through a dedicated team and social services. The Senior Safety Unit involves a partnership with the Durham Regional Police Services and Social Services, and this team responds to crisis calls for seniors living in isolation and or experiencing safety-related issues that can involve financial, physical, or emotional abuse. And in 2022, over 690 calls were responded to. In 2022, the Homelessness Support System helped 218 individuals from the by name list find housing, and of these individuals, 131 of them moved from chronic homelessness to stable housing, which refers to people experiencing homelessness for more than 6 months in the past year. The 10-unit microhome pilot project provided temporary transitional housing, along with various supports to some individuals experiencing homelessness. These supports include financial assistance, employment services, mental health and addiction supports, life skills teaching, and more. And in 2022, we saw 2 individuals move towards independent living through the supports that they received. The Adult Protective Service Worker, APSW team, provided support and coordination to 146 at-risk individuals with developmental disabilities. This included assistance with accessing and maintaining housing through homelessness prevention support, housing subsidies, and life stabilization case management. Further to homelessness prevention, the APSWs have provided case management and advocacy services to an additional 391 adults with developmental disabilities. The Durham Access to Social Housing DASH waitlist is a vacancy-driven waitlist where applicants can view and express interest in RGI, modified units with community housing providers and private landlords with rent supplement units or portable housing benefits. And of the 527 households that secured housing in 2022, 232 were rent geared to income units and 295 were under the Durham Portable Housing Benefit or the Canada-Ontario Housing Benefit, COB. And housing services continues with efforts to create more affordable housing units across Durham. There were 75 units completed in 2022 with an additional 170 units still under development. And since 2014, there have been 466 affordable housing units established. The additional 170 currently in progress brings the total affordable units to 636. Although short right now of the goal, Council's goal of 1,000 new affordable units by 2024, we are confident that this target can be achieved with the other projects coming forward. An example of this is through the At Home Incentive Program, and a report will be coming to you in the coming months. In addition, staff have provided assistance to over 29,000 households with homelessness support service ranging from prevention to housing outreach. The new Canada-wide Early Learning and Childcare System, also called CWELC, involved the enrollment of 264 childcare centers and 4 home childcare agencies. This was a significant undertaking by this Children's Services team, Early Learning and Childcare team. This included education, information, and outreach to families and the childcare providers throughout 2022. This was substantial. The Family Services Division delivered 9,500 counseling sessions to individuals, couples, and families. These support services delivered aim to improve mental health, employability, stability, and safety of individuals, couples, and families. These services continue to be offered both virtually and in person across Durham. And further to the community counseling, Family Services provided targeted interventions to 1,000 individuals in receipt of social assistance, Ontario Works. The counseling and mental health services promoted healthy and supportive progress towards community participation and successful re-entry or realignment of employment. Across the 4 regionally owned and operated long-term care homes, staff continue to provide much-needed care for 847 senior and vulnerable residents with complex conditions and multiple medical needs in the face of COVID-19 outbreaks and staffing and resource constraints. Throughout 2022, long-term care continued to manage strict COVID protocols for residents and families, as well as the ongoing recruitment efforts due to staff shortages in the sector. In 2022, 412 new staff were trained. In addition, in the midst of COVID-19 response, the Long-Term Care Division successfully met all the requirements of the Fixing Long-Term Care Act Phase 1. And more recently, they were accredited under Accreditation Canada, and a report will be coming shortly. You will see on the slide before you the proposed social services expenditures for meeting the needs of Durham residents. The budgeted programs and services are comprehensive by meeting the needs across the lifespan, from the early years to long-term care residents. Social services represents $685 million in gross expenditures, of which 59.5% comes from the federal and provincial investments, with the remainder coming from the local property tax base at 20.2%, along with reserve funding, program fees, debenture financing, and other miscellaneous revenue. The total net budget increase represents $6.7 million, or 5.2%, and the total expenditure increase is approximately $268.4 million, 64%, which represents significant continued investment in our programs. For 2023, we have seen significant investments in the frontline staffing of long-term care and additional investments in childcare and early learning with the implementation and rollout of the Canada-wide Early Learning and Childcare Program. This increase also includes the capital construction costs of the Seton Long-Term Care Home approved in December of 2022. The majority of our budget being funded by provincial and federal investments, this represents a strong partnership with our colleagues in the upper levels of government for continued investment in people and in our community. The increased regional investment of $4.9 million will help to address priority areas to the homelessness prevention and support system, including increasing street outreach, housing-focused shelter supports, and housing programs to get more people housed faster. This brings our total regional homeless investment to a new total of $6.3 million. And you may recall this was only $27,000 years prior. Investments will be priorities to address homelessness for sustaining and developing shelter programming, the 2023-24 winter response plan, and enhanced outreach and housing programs, and include continuing shelter programming for Ajax and Whitby to support more people, developing a coordinated and centralized phone number for people to access supports through service navigation using a 24/7 phone line. Adding more housing-focused street outreach teams to support more people living unsheltered to end their homelessness. And adding more than 60 new housing outflow opportunities for specific population groups on our by name list. These placements include different programs and support models and specifically target people who are chronically homeless with high acuity. A new partnership being developed will support pre- and post-addictions treatment for up to 20 people. People who are chronically homeless with low acuity. A new benefit being developed to target people with low support needs, but who are experiencing chronic homelessness who don't need intensive supports. This will effectively end chronic homelessness for this population group. Youth experiencing chronic homelessness, so we're expanding a successful Housing First model for youth, double our capacity, and will effectively end chronic youth homelessness in Durham using our current by name list numbers. And we're also looking at a new partnership, a new program for veterans who are homeless that we're looking to target, and also to end chronic homelessness for veterans. It is important to note that reducing chronic homelessness to zero for these population groups is only a temporary measure. We need to be able to sustain this in order to have achieved functional zero and truly end chronic homelessness for these population groups. These priorities balance immediate needs of increasing shelter and street outreach. Our inflow into homelessness continues to exceed our outflow to housing, and we will continue to see an increase in homelessness across Durham until we are able to reduce our inflow and increase our outflow to housing. We will continue to work with the sector tables under the Durham Advisory Committee on Homelessness, the DAC, to strategize and adjust as needed. The Beaverton Supportive Housing Project was approved by Regional Council in 2020, and the development of the site is underway with tenancy to take place in late summer 2023. $0.8 million is proposed for operational costs for this year, partially offset by rental revenue of $0.1 million. An external support provider will be retained to provide 24/7 services for the 47 residents of this building, and the RFP process is currently underway. $5 million of the provincial subsidy represents an additional 54 new positions in temporary staff in long-term care to increase the direct hours of care per resident from 3.0 hours to 4.2 hours per day. $1 million has been identified for 14 new positions, partially offset by provincial subsidy, and include 1 to support children's services, 1 to support family services, 3 to support the new integrated employment services, and 9 to support service delivery in the long-term care and services for seniors division. Capital costs related to a new long-term care home in Seton, as noted in 2022 COW-32 report, is outlined for a budget of $126 million. Provincial subsidy and related outflows for the implementation of the Integrated Employment Services Program is $12.2 million. We continue on strategic highlights. Then this slide outlines provincial subsidies and related outflows for other various programs across social services. The delivery of the Canada-Ontario Community Housing Initiative, COCHI, and the Ontario Priority Housing Initiative, OFI, is budgeted for $6.8 million. The COCHI funding is used to address urgent capital repairs within the community housing portfolio, and this can include health and safety, as well as essential property elements such as equipment. OFI funding supports the development of new affordable housing units. Outreach and life stabilization support will be increased for adults with developmental disabilities through the Adult Protective Services Program at $0.2 million. Within Children's Services, there is $110.7 million proposed for the implementation of the Canada-wide Early Learning and Childcare Plan. Increased investments related to early learning and childcare and the Early Ons and children's mental health programs totals $0.9 million. And there's also a one-time funding investment of $3.2 million in fee subsidy for childcare providers and administrative costs. There are a number of risks and uncertainties I would like to share with you. Human service needs are met with the delivery of social services programs and services by provincial, federal, and regional investments. The most significant risk in social services is the uncertainty of provincial investment. The 2023 budget submission includes provincial funding based on current funding levels and information available from the province. Provincial changes to funding levels, cost-sharing formulas, and program design have direct impact to service provisions and support services. As an example, in 2022, Durham received $2.8 million in SSRF Phase 5 funding, which was a significant and critical investment that went to services that support homelessness prevention and capital repairs. And this program funding has ended despite an ongoing need, which has created an additional gap in funding for critical supports to address homelessness in the community. Reductions in provincial investments have a significant impact on the region's own resources and its ability to address growing community needs, such as homelessness and poverty reduction efforts. For instance, the provincially funded Homelessness Prevention Program, HPP, showed no increase over the 2022 amounts. And additionally, the province is limiting funding for the delivery of Ontario Works funding allocation equal to the 2018 actual expenditures. Continued uncertainty in provincial investments puts heightened pressure on our local tax levy due to the increasing cost to fund shelter beds, outreach, rent supplement, housing allowances, and support for people to find and maintain housing. Impacts to communities from the COVID-19 pandemic continues to increase the need for human services response. Should sufficient funding not be available, the region will need to consider further cost mitigation measures across the corporation or the use of operating impact reserve funds. Phase 2 of the Fixing Long-Term Care Act 2021 comes into force this spring of 2023 and may impact on operations of the homes through changes to regulations and inspection protocols. The increase of inspectors and punitive inspection protocols will have impact to staff morale. The provincial direction for increasing daily direct nursing care to 4 hours of care with increasing allied care hours will place added pressures on the long-term care operations because of staff recruitment in the healthcare sector being such a challenge. Meeting these increased hours of care standard may result in increased overtime and/or working short-staffed. And while the Phase 2 regulations are not yet finalized, it is estimated the cost to homes may average $42,000. And the funding provided during COVID for infection control is still required, and there's no guarantee that this will continue. However, regional staff, in partnership with long-term care partners, will continue to advocate for provincial funding and regulatory changes that meet the needs of our long-term care residents. And as we know, the impact of Bill 23, More Homes Built Faster Act, limits the region's ability to collect development charges to support the delivery of infrastructure and critical housing for vulnerable populations. Forecasted pressures include the annualization of 14 new positions proposed in the 2023 budget, estimated at $0.7 million. And of the 14 positions identified, there are 12 impacted by future annualized costs, and 2 are budgeted for full year in 2023. A new long-term care in Seton, approved in December of 2022, will require significant regional investment in operating costs, with net regional operating costs estimated at between $22.5 million and $24.8 million, as noted in the report, in December's report. And Children's Services staff continue planning efforts for the addition of at least 2 new directly operated regional childcare centers through local partnerships. The new childcare expansion projects in Bowmanville, and Sunderland will both serve children 0 to 12 years old and are projected to open in 2024. Both of these expansion projects will service areas needing access to increased childcare and align with the childcare expansion plans for Durham. And both projects will be part of the new Canada-wide early learning and childcare system, ensuring low fees for families. The aging Durham Region Local Housing Corporation portfolio and the buildings of social housing providers continue to require significant capital investments to maintain the housing units. A recommended approach for the potential redevelopment, intensification, and regeneration of 4 DLHC sites in Oshawa continues to be worked on. Enhanced and sustained resources and supports are required to prevent and end chronic homelessness in Durham Region. This will require a coordinated funding approach across every level of government, as homelessness prevention is a federal, provincial, and local responsibility. I will now invite Commissioner Taylor to say a few words about the social services budget.
Thanks, Stella. You've seen this slide before, so I'm not going to repeat here. I mostly just wanted to say for this particular slide my appreciation and thanks, and as has been expressed. But for those of you that have attended and listened into all of the budget meetings during the course of this week, my deep gratitude for the sheer magnitude of partnerships and relationships that combined to put all this together and work to achieve outcomes. Mostly, this is a new slide and a new approach to this committee, recognizing the significant priority of this committee and regional council to invest in housing and homelessness programs to ensure the needs of our most vulnerable community members are met. I wanted to take a moment to provide committee with an overview of the proposed 2023 regional investments in homelessness and housing programs, both within the proposed 2023 social services budget before you today, but also in the corporate budget being presented to Finance and Admin Committee on March 21st. I didn't want there to be a gap in your knowledge because it comes across in a couple of different budgets. So the proposed 2023 regional budget includes $107 million in funding for homelessness supports and housing programs. Of this, $65.5 million is regional funding, with a balance of $41.8 million being provided through rents and provincial and federal programs. So this is a $17.7 million or 20% increase over the 2022 budgeted investment. And the region's investment alone is increasing by $6.6 million in 2023, with $4.9 million of this increase directed towards homelessness support programs. And as Stella referenced, just 2 years ago, this was essentially zero. In addition, with the region engaging the community and stakeholders on the social housing redevelopment projects in 2023, we recognize that the region, in partnership with both the provincial and federal governments, will need to further increase these investments in 2024 and over the forecast period in order to address those community needs. You will also see a report on this month's Committee of the Whole regarding the at-home incentive program that Stella referenced. So in addition to the numbers that you see here, we are also still looking to see if we can support an additional reserve fund top-up to this program for a 2023 second market opportunity, and I'll be chatting with Al quite frequently to try to figure out what we can do there to have yet another phase. So that's not including these numbers. That'll be in addition to this. So thank you, Chair and Committee, for the opportunity to highlight these critical investments. Stella and I and our teams would be pleased to respond to any critical questions.
Thank you. Thank you very much to both of you for your presentation. I have Councillor Jubb.
Thank you, Madam Chair, and through you to Commissioner Danos Papa Constantino. Is that even close? Okay. I've been practicing since Election Day, and it's been quite stressful.
Thank you. I'm sorry about that.
On a serious note, Stella, thanks for the report. Thanks to your team for all they do. First, to start with the Oshawa Micro Homes project, can you remind me what the budget for that is for operating for this year? I didn't seem to find it in there.
Yeah, it's a really good question. I'm going to pass it over to, is it Director Dixon? Through the chair, sorry, through Director Dixon.
Through the chair, it's around $8,000 annually.
Oh, okay. Perfect. Thanks for that. Now, finally, on to the Beaverton Supportive Housing Project. The operating cost is estimated to be around $800,000.
For 23,
For
yes.
23?
That's
Okay, and that's including all operating, the nurses, mental health professionals, water, sewer, everything?
Correct. And remember, we won't even have the full 47 in.
Yeah, so that's what I'm getting at. So I seem to remember a number of 1.3 million was the estimate?
That's right, for the full year.
Okay.
Correct. I think it's roughly 1.5 million. I'm looking to, sorry, Director Robbins here, because we're doing some work on this right now through the chair to Director Robbins.
Through the chair, yes. So I think that 1.2 or 1.3 was back 3 years ago when we first brought up the supportive housing project. As we know, costs increase in absolutely everything over the last 3 years.
Okay.
So we're looking at, for the first year being a partial year, this budgeted amount to cover all of the operating costs, including the support services.
Okay.
The support service operator for this first year, which will be prorated based on the number of months they're working. Then the full annual budget will be reflected in 2024 when we have 12-month period.
Okay, thank you. That clarifies it. I was just wondering why the number was different, but that makes perfect sense. So as we know, the org code study explained that in order for this project to be successful, it needs excellent support services.
That's right.
And we all want to see this be successful, of course. Are you fully confident 100% that the budget amount in 800,000 is going to find a quality operator to meet our goal on this? Or would you be, what I'm trying to get at, would you be happier if this committee could recommend a little bit higher budget to be proactive and safe?
Through the chair.
Sorry to put you on the spot.
Of course, we're always happy to have more money go to the Beaverton Supportive Project. As Director Robbins said, we did base it on earlier estimates and things have changed, and the location, of course, being where it is, and understanding how difficult it is today to get resources in the north. Additional funding is always welcome.
Okay, thanks for that, Commissioner. And I will have a motion ready when appropriate, Madam Chair. Thank you.
If you could also have that forwarded to the clerk as well too, prior to presenting it, that would be helpful.
I'll try to scratch something out quick.
Sorry, if I may, through the chair to Councillor Jubb, what will happen, just to give you some reassurance and perhaps avoid the need for a recommendation, but that certainly is up to you. When we get the actuals in through an RFP process during the course of this year, we would automatically then reflect any required impacts in the 2024 year. So we will have that covered. It doesn't matter when the costs come in for the quality of service that the department is looking for, we would factor in the necessary increment in the 2024 budget.
Okay, thanks for that, Commissioner. Now, if it came back at, instead of 800,000, let's say $1 million for a nice number, you would come back to committee in 2023 to up that 200,000?
So through the chair, through 2023, we would simply award. There are various provisions within both the purchasing bylaw and the budget management policy that it would allow us to proceed. We could certainly bring an information report, but it wouldn't hinder us from proceeding with the project.
Okay, that makes me feel much better, so no motion needed. Thank you.
Thank you very much. Any further? Mayor Carter.
I'm glad we got a clarification on that, because I was about to say I got a motion too for Oshawa, because if we're going to do it in up north, we're going to do it here. So my question being is, on the microhome project, if I heard correctly, it's $80,000 as an operating cost on an annual? $8,000?
8.
Sorry, 80. Yeah.
8?
80. Sorry.
$80,000. Okay. So my question, the follow-up on it, that includes staff that are at that location on a daily basis?
So we have staff through our Ontario Works program that are attending there. Their salary is covered through the Ontario Works subsidy.
So it's not including in that
Not
particular budget?
attributed to that, no.
Okay.
But it through the chair, but it does include our support partners who are there to support through Cornerstone and Lake Ridge Health.
Okay.
And also our DLHC staff.
As we all know, we made the front page of the Globe and Mail today in regards to the microhome project. So I'd really like to make sure that we've got the right resource in the right place. And if that means additional funding, we've got to do that and resources. So I'm tired of being on the front page of the Globe and Mail, to be absolutely honest. Part of this budget that we're moving forward with Have we allocated dollars in regards to shelter redevelopment or modernization? Is that included in this particular budget, Commissioner?
Through the chair, we're doing our analysis now and coming back to this committee in May with a further homelessness update report. So we're meeting with our DAC committee. We're taking the allocations. We've identified some highlights within it. Shelter redesign. We're creating new shelter spaces, as you know, and we're looking to expand our shelter spaces. So through that process, I can't sort of promise shelter redesign in language like that, Mayor Carter, but we are looking at the shelter system.
Is there any way that your department could take under consideration an actual business plan for 2024 in regards to the redevelopment of our shelters, including existing shelters, to be able to modernize them with a budget line that would be appropriate to start addressing it? I'm thinking of Cornerstone and Oshawa. It's old, it's dormitory style. It really needs to be modernized. Now, I don't also know what kind of authority we would have over Cornerstone in regards to that initiative, but I'm just wondering if we might be able to make sure that in the 2024 budget, we take that under consideration and have it part of our plan, please.
So through the chair, they are their own entity. They are a
Right.
board. We do fund them through
Right.
the homelessness prevention program funding. Also, they do have plans for redevelopment and modernizing their system. They've had their plans in place for a while, but due to COVID, they've paused them. But I do know that Director Robbins has something to add to this, Mayor Carter, if it's okay
Great.
with you.
Yeah,
for him
no,
to
I'd
add.
like to hear
Thank
that,
you.
please. I was looking at the CAO too. I thought maybe she had something because she hasn't been included in the conversation today, so.
Yes, through the chair, we are meeting with the executive director of Cornerstone to look at a number of opportunities they have to modernize their shelter, both for the current site as well as opportunities in land adjacent to that site. So we are in active communication with them, looking at what their long-term strategic goals are and how we can help them accommodate and reach those goals either through future regional funding or federal provincial funding as it becomes available. Because what we want to do is we want to be ready for any funding that's available and have projects as shovel ready as possible. So we are meeting with them on a regular basis and trying to help them meet their long-term strategic goals, which include the modernization of their shelter and the incorporation of additional supportive housing units to move away from that dormitory style.
So there's a whole bunch of follow-up questions that are probably appropriate for a sidebar, not part of a budget discussion, that I'd like to try and engage you in regards to our readiness, their readiness, all those kind of things. I'm hoping that those conversations are also going on with our team at Oshawa to make sure that we're aligned in regards to what's feasible, what's possible, and what role we're going to play. So I'll move on from there. I'm really pleased that we're continuing down the pathway of modernization, diversification, and divestiture of our housing stock. So I'm really pleased about that. And I think that 23, 24, and 25 will play an important role in regards to really modernizing that file. Am I correct in this, assuming that based upon this budget?
Correct.
Good.
Well,
Good.
yes, correct.
Okay. The one item that you had in your budget presentation is 29,000 households are receiving support in regards to the housing file itself. That is concerning to me. That 29,000 homes need assistance one way or another in regards to securing their households. Is this part of, this is about keeping people in their homes. Is that number continuing to grow, and is the region directly funding the support of those households, or is it a combination of regional and provincial?
Through the chair, it's a combination of our regional funding, somewhat funding investment. Really, it's staff time, staff resources,
Right.
and the provincial funding. And it is to keep people housed, to communicate with the landlord, to make arrangements to ensure that they're able to pay their rent, to help them find the right housing. People from across Durham, there's probably no one area that I'm going to highlight here because people from across Durham are looking to us for this support.
Doesn't that beg the question that there's something fundamentally wrong?
Yes,
Okay.
it does. And through the chair, we do know that our social assistance rate are what they are, OW, ODSP, they're low, OW the lowest. And someone who's getting $733 a month, struggling with so many things, trying to sort of keep, roof over their head is a challenge. So we're often finding ourselves supporting these people. And
More follow-up questions on that on another time because it's not budget related.
Yeah.
68 new positions, am I correct by that?
Yes.
Okay. How many of them are outreach workers? You knew this one was coming, so go ahead.
Well, no, I don't have that number officially identified right now. That's part of the work that we're doing to take away. So I will be coming back with a proper number in May.
Does that mean that there is consideration in regards to outreach workers through the region, through social services that will be available in 2020, 2023?
We're looking at whether it's coming through social services or through our partners in the community. We're looking at both options.
Can I once again express that I think it should be a regional initiative?
Yes.
The reason being is we talked about this fair wage. That was
Yes.
one of the big issues. The other thing is the reporting mechanism and also the care and control aspects. Agencies, I think that we don't have as much authority over them. And I'd like to express that really is, maybe it's a combination of both, but I'd love to see the region lead on this, not just allocate.
We're taking that away, sir.
Okay, thank you. In your business plans, and I must apologize if I missed it, but I have to follow up in regards to the opiate crisis. Is there certain specific initiatives that you're undertaking through your budget process and your request this year in regards to addressing the opiate crisis, or is that strictly just a healthcare issue?
Through the chair. Well, it is a healthcare issue, but we do work in close partnership with our partners in health, our partners in paramedics, through PCOP, through the mental health outreach program that we have, through our outreach workers to do our part. We do have staff who are naloxone trained in our social services offices who support individuals who overdose. So we are participants in a social service way.
I'm also concerned. I think there was a slide that talked about levels of funding that's coming from the province that is basically flatlined. Do you know what the impact on this particular budget would be because of flatlining?
Well, if we didn't receive the funding that we did from our regional investment, we would be looking to probably reduce our hub hours and
Some of your
supports.
hub hours?
Hub hours and supports. Certainly outreach would not be possible. Maybe we would keep the outreach we have, but we wouldn't be able to increase in any way. The homelessness prevention funding that I've talked about, helping people to remain housed and not become homeless, would have to be reduced. We would see reduction in our services across the board.
So, Madam Chair, I don't know, it's a question maybe through you, and I don't know where you want to direct it, and it does have to do with the budget, but it is kind of about taxation at the same time. And maybe the regional chair or the CAO may be able to help us with this. Do we have any authority in regards to a specialized levy that we can insert in regards to the impact that some of these shortfalls would have in regards to social services?
I think commissioners could answer that.
So through the chair, for any component of the regional budget, we have the technical ability to create an individual tax rate for that. Then we would provide those bylaws to the local municipalities. Their billing systems would have to have enough room for any of those additional lines. So we could certainly carve out a dollar value and create a separate bylaw for that, similar to how we have transit and waste. So from a billing perspective, it would be visible on the bill, but the bulk of that workload would be the local municipalities having to adjust their tax billing systems to accommodate for additional lines. So from a practical process-related thing, we can certainly show something different on a tax bill, if that's sort of the source of your question, but it's more the locals that have to do the work around making that happen. We could give them a bylaw and they'd have to do the work around making that
So
happen.
would that be a development charge, or would that be just a specialized tax levy?
So all that would be through the tax bills is a tax levy. Through development charges, as you know, on Bill 23 deleted housing as a component. So we've lost those monies, and historically the region used that to fund our partners for development of housing units. So that's been lost under Bill 23.
Okay, I know we can't do it, and I'm not going to make, suggestions in regards to the budget on the fly. I don't think that's fair. But I think what we should do is maybe this year have a conversation about the concerns about funding shortfalls, what kind of solutions we can come up with. Because I'm concerned that this is going to be a continuing theme that we're going to be losing dollars or flatline funding. The last question I have is, you've done a tremendous job in regards to children's services, long-term care services, and those kind of services. And it seems that it's got a huge amount of support from the federal and provincial government. My question to you is, why is it that there seems to be so much that the provincial and federal government believe that that's such a priority that they're going to push not only regional governments to invest into, but they don't see the same issue in regards to the opiate crisis or the housing crisis? I'm baffled by that. Do you have any answers in regards to that, or is that too much of a political question?
Through
If
the
it's a
chair,
political question, don't answer.
I'll give you a response. I don't know why, particularly, other than the focus on children is important. So the early years is important. The focus on seniors, the vulnerable, is important on either side. The in-between, sometimes the government thinks that people don't understand what people are struggling with, what mental health and addiction is, what mental illness is, what a breakup in a family can do. And they think that people are maybe just not willing or not wanting to go to work and make a living and pay their rent properly and do all those things. So that's my non-political response.
Yeah, I don't want to put you in that position. Madam Commissioner, to you and your team, housing team, and everybody that's associated with social services, I thank you very much for the service through, in my opinion, not only one of the most complex times we're in right now, but I think we're looking at the next 10 years of the most complex times when it comes to social services and income insecurity, food insecurity, housing insecurity, and I think local and regional government are going to be playing more and more of a role, which means we're going to have to look at creative ways of finding revenue sources to be able to support programs. But on behalf of my city and I just want to say thank you very much to your team for all the work that you've done, and continue the good work. Thank you. Thank you, Madam Chair.
Thank you, Mayor Carter. I'm going to call upon Mayor Schumer.
Thank you, Madam Chair. Through you, thank you very much, Stella, and your team for bringing this to us. A lot of my questions have been asked. I might just get some clarification. So the total or the net impact of the tax levy at this point is about 6.6 million. Is that correct?
The net impact on yes. An increase of 6.6 million. So I have to look at my notes and apologize for jumping to an answer.
No, that's okay. I think it was
Looking
actually
to
a
my-
number quoted by the Commissioner of Finance. So
Yeah, net budget increase is 6.7 million, but I don't know if that's what.
that's net.
Yes.
Going back to the Beaverton supportive housing, so it said 800,000 would be the operating cost for this year,
Correct.
and there'd be 100,000 in rent. So is it 700,000 or is it a $900,000 cost minus rent?
I'm going to just, through the chair, I think Director Dixon, you're going to take that? Thank you.
Yeah, through the chair, it's an $800,000 cost, and then 100,000 will offset. So net 700.
Okay, great. Thank you very much. Just trying to go through my list here. A lot of it's been crossed off. Yeah, so the annualized is 1.5. And am I correct in understanding that the goal is 1,000 supportive housing units over X number of years? I know earlier you mentioned 1,000 affordable housing, but I know a couple of years ago it was 1,000 supportive housing. So is it 1,000 supportive housing that is the ultimate goal?
Through the chair, it's 1,000 units of housing. Affordable, of course, is what we would be looking at. And affordable, supportive is under that affordable umbrella in our lens.
Okay. The only reason I bring that up is, I kind of start looking at 1.5 million operating for the 47 units in Beaverton, extrapolate that out, and you're looking at like $32 million operating costs for 1,000 units. And that starts to get pretty scary. And I think you're acknowledging that by nodding your head.
If I can add, Mayor Schumer, through the chair, we are advocating to the province to be funding supportive housing in the future. We should not be funding it. It should be coming through the health system. This is a unique project for Durham, but it really should be coming through the health system.
I would agree. It's healthcare. And we continue to have downloaded costs on the municipalities. It's becoming the norm, unfortunately. And it's when the province gives up $1 billion in license plate renewals and then claims that the cupboards are empty for healthcare, I have a hard time believing that. So the 1.5 million, how does that compare with the business plan that would have been done, like a couple of years ago, 2 or 3 years ago, when the project was first being conceptualized?
Through the chair, I'm going to ask Director Robbins to respond to that.
Thank you. Through the chair. As I'd mentioned earlier, the initial estimate roughly 2-3 years ago was based on the Toronto model. And as we know, costs have increased. And we have had consultation with various support agencies looking at staffing costs and staffing levels. And that's how we reached the approximately 1.5 million to cover the support needs for the building. I do want to note as well that I have been in consultation with the Durham, Ontario Health team with respect to getting information out with respect to this project, and will be presenting to the Durham, Ontario Health team on March 22nd to talk about this project and the opportunity that it creates for our community partners to provide their services in an environment that their target population is already living in. So there's lots of opportunities for our community partners who have a mandate to assist people with mental health and addictions to be able to use our facility and use their funding to help move their mandates forward. So in addition to the support services that we'd be paying for, we're also looking at those additional services to further the mandates of our community partners.
Thank you, but I was just trying to get clarification. 2 or 3 years ago when this was being conceptualized, what was the business plan saying that the operating cost would likely be annualized? Were we close to 1.5 or?
1.3.
So through the chair, the initial estimate based on the Toronto model was 1.2, but as I'd mentioned, that was 3 years ago in a Toronto context. So this has been revised to make it not only a made in Durham, but a made in North Durham solution, and to appropriately fund it that way.
And, thank you. And are any of the associated or possible costs for any of the items that were in the memo of understanding or whatever you want to call it with the township, are those costs in this, have you factored any possible costs having to do with that agreement into the cost of the operations, or is this strictly, basically covering the operating cost with the service provider?
Yeah, so through the chair, yes, the estimated cost in the 2023 budget includes the support service delivery, as well as those costs that the region committed to contributing, such as the security. So it is the entire cost.
Thank you. I think the rest of my questions were answered. Thank you very much.
Thank you. And I'm going to call upon Mayor Foster.
Madam Chair, thank you, Commissioner Danos Papakans. So you see, I have been practicing this,
Yes.
and have done far better. Stella.
Yes, okay.
We're going to have to say Commissioner Stella to recognize. Just a quick follow-up from Mayor Carter. 29,000 residents, homes helped. The total number of, I'm going to call them front doors in Clarington or Pickering, are around 34,000. So you're talking about virtually the entire populations of Pickering or Clarington? Just to put it in perspective,
Yes.
is that a,
Correct. So it's substantial.
are we putting any thought towards the next few years? So with house prices dropping, interest rates increasing, we are starting to read now on the follow-on from families that we hadn't considered would be at risk, that will be at risk. So affordable, attainable housing is wonderful, is necessary, but the flip side of that is a massive destruction of wealth as houses come down. Moving forward, is there any discussion or dialogue on what could be a similar but distinct crisis and role that we might have to play?
Through the chair. So I understand your question, Mayor Foster. You're talking about those living in poverty, deep affordability, and preventing homelessness with the working poor. Is this
No,
your question? Sorry.
I'm concerned. We have spoken about families that couldn't find rental, that were never on our radar before. We've spoken, Habitat for Humanity has changed its business model where their clients are no longer people that were in deep poverty or trying to get out of poverty. It's a matter of affordability. I have some serious concerns for young families, for example, that bought at the peak of the market. Mortgages are coming due at significantly higher interest rates. Quite frankly, I have no idea how a young family is affording food, diapers, daycare, and a potential looming crisis for a subset of individuals that we would not have thought that we were providing services for, and we may need to. So I'll leave that thought with you, and I hope I'm 100% wrong. A request from you and Commissioner Taylor, thank you, bringing the homelessness piece together. So looking at the budget, we went from $634,000 to $5,069,000. I'm sure that all in the room are hearing complaints that we're not doing anything to address the problem because it is becoming so visible. Is there a way of getting some communications out to simply address, educate both ourselves, and the public on the massive attempts that we're making? Commissioner Taylor?
And certainly our CAO may comment as well. This year for our budget communications plan, we have worked very closely with the communications division in the CAO's office to change our strategy a bit around communications for the budget. We would do lots of high-level communications and then we'd wait till the budget's approved to start to message it. This year you will hopefully have seen, and during the course of this week every day and next week every day, you will see social media bursts on all of these priorities. So there's one on homelessness, there's one on paramedics, there's one on police, there's one on transit. So we are actually trying to make sure that those key strategic priorities that Council wanted to see and that we put forward through the guideline actually have individual lead-up bursts now, as opposed to waiting till the budget's approved and saying what we've done with the budget. So hopefully that at least helps some, that we want to message that ahead of time. But we are working with Alison Burgess in communications to also do better and greater every year on our communications with respect to budget. So I say, I don't know if the CAO wants to add anything there. It's her.
The only thing I can add is that we're also looking at how we communicate throughout the year with respect to the services we deliver and the investments we make. And we'll be trying to be more rigorous about that so that not just at budget time, but through the 12 months of the year, we're better communicating the services that we're delivering and the outcomes of those services.
So, Madam CEO, Commissioners, thank you for that. This piece of the budget, I'm trying to come up with the right word. I'm going to say awesome in the true sense of the word awesome. If you look at the sheer amount of things that you are doing, and it's difficult to communicate to the public, just the variety and depth of things that we are doing. Stella, I'm going to ask the same question. I warned you that I was going to do that. So as we find efficiencies, A follow-up to that question, the pandemic shifted needs. We are overusing the word pivot, but you had to pivot given limited resources. Things were left behind, and there's some notice. I'll ask Dr. Kyle about this when we get to the report. Did you leave things behind that you really wish you didn't have to leave behind on the efficiency side? And thank you for saving money. You get criticized for saving money as well as spending money. That's the nature of the beast. And were things left behind that we, moving forward, that we need to pick up and reconsider?
So through the chair, I can't say I left anything behind because we haven't reduced our services, which is a huge plus during a time like this year with all the needs that are happening in our community. I would like to say that where we have gaps would be in our external funding, our funding from the other levels of government. So if there's anything that I could ask for us to continue to do is talk to our government about increasing social assistance rates, because we can't continue to do what we're doing. It's like we're on a hamster wheel sometimes. Without increasing the rates, it's a Band-Aid. Everything that we're doing sometimes is just to sort of keep people living in poverty. We're not doing anything to help them get out of poverty. So that would be very helpful. Additional housing, homelessness funding to come our way. They understand there's an issue, but we haven't seen that funding increase. So these are the things that I would like us to see move forward. But I'm confident that with the investment in our budget this year, we will be able to achieve some incredible outcomes.
Thank you. Mayor Carter and I were talking about chasing our own tails, and the faster you go, the harder it is. Thank you for that, Madam Chair. Thank you.
Thank you, Mayor Foster. Chair Henry.
Thank you, Chair. And just with permission of the Chair, a little bit of a preamble, if I could. Members of the committee and staff, we are the heavy lifters for all of the needs of our residents within our communities. And most of us sit on other committees, Marco, AMO, large mayors group. And at the table, Commissioner, the conversation is about mental health, opiates, addictions, and homelessness. And Mayor Carter said the perfect word. It is a crisis, not one, but all of them. Through your team, do you in your association, you're probably having the same conversations.
We are.
So, Madam Chair, the next question is maybe a little political, so I probably won't ask for an answer, but if you would allow me. So, if the problem is the same in every municipality in Ontario, every municipality in every other province on our territories, Mayor Carter used the word, would it be considered a crisis?
Through the chair, yes.
So, Madam Chair, I know that I get a chance through Marco and the work that I do to speak to my peers. Are there conversations with our staff going on with any other level of government to look at the root cause of the challenges that we're currently having in our community or the province or at the federal level of government?
Through the chair, no. We're having conversations with our colleagues from across the province, other municipalities. We have staff meeting, homelessness staff, service system manager staff are meeting to talk about the issues. We're putting together, documents, inviting members of the ministries to come and join us in meetings so that we can present our issues and our requests for either additional funding or supports. It's not moving along very quickly on our part.
Madam Chair, just to follow up on the crisis issue, do we know if anyone in this room knows whether the federal government is identifying that this is a crisis? Dr. Kyle? No. The next question is, Commissioner, when we do this budget, I want to thank, I think this is my 5th regional budget meeting that I've sat through. With all of the money that we're spending on health and social services this year, Dr. Kyle can input. Do you think our efforts will reduce the challenges that we're currently seeing in our communities, or do you believe those challenges will continue to grow?
Through the chair, based on current numbers that I have, for instance, my homelessness numbers, with the funding that we are getting, we will be able to see a reduction in the current numbers that we have in certain cohorts, as I mentioned earlier. However, there's a lot more people coming into the system. So we need to find a way to support the prevention side even more. And that you can only do through wages, fair wages. You know, the living wage in Durham is now $23. It was $17 a couple of years ago. That's substantial. But people in our community are not making $23 when they're working in the service industries, or some of our other partners are not paying that either.
Madam Chair, if I may continue down my little bit of a rant today.
Yeah, no, go for it. It's all yours.
So, you know, there was a problem identified when this country was formed. That connecting our coast to coast was a challenge back 154 years ago. And they realized that they could build a railroad and cross this entire country through mountains, major rivers, tunneled through mountains. And they were able to do the railroad. Is it time that we put the same effort into the challenges that we're having in this country and start to talk about the problems collectively and how to fix this? Because personally, I believe no matter how much money we put into this, without having the tools in our toolbox to get people to proper mental health, addiction, and homeless support, we are never going to get out of this crisis that we're currently in.
Is that a question for me? Sorry, through the chair. Yes, I totally agree. We need funding from all levels, but you have to look at health across the board, housing across the board. There's a lot of elements to this.
So, members of council, I'm not sure if the time is today, but there should be a time that our council sends a distinct message to the other levels of government that this country is in a crisis. You know, we're watching, they can call special meetings to have conversations about things that really don't affect the individual lives of our residents. But I can tell you this affects everyone in this room. There isn't one person in this organization, some 6,000 employees, that isn't dealing with either mental health, opiates, addictions, or homelessness. It is a crisis in Durham. It is a crisis in Toronto. It's a crisis in Vancouver. It's a crisis in Victoria. It's a crisis in Ottawa. It's a crisis in our northern territory, our northern part of Canada. And I'm frustrated, and I don't know how we fix it. But there has to be a conversation about what went wrong, where we failed, how do we fix it, and what are the steps to go forward. There has to be. Otherwise, we will never fix this. And it is unfair to put this on the backs of the taxpayers in any community when we have no controls at our fingertips to can force someone to get addiction counseling, or can force someone that has bad behaviors, who is a habitual problem, ideally drug dealers that prey upon our people. We don't control what happens with them. The courts do, and we have no say over the courts. This is frustrating. Mayor Carter, I have, and you know, and the other mayors, that I am totally sympathetic to the challenges that you're having in your communities, and we're doing the best we can. But there needs to be a bigger conversation, and the time has come, and I can't believe that there isn't a community in this country that's not suffering from the same thing. So if this isn't a crisis, I don't know what it is. That's my rant for the day, and I apologize.
No, and I appreciate it, because I have a couple of comments later on as well too, but I think there's just a lot of talk, but not a lot of action, and nobody's willing to champion it at the federal level either, even at the provincial level. There's no champions. And somebody asked the question, which was the political question, which I believe was Mayor Carter. The reason why there's no attention to opioids or to homelessness is they don't vote. Matter of fact, that's the answer politically, and I'm saying that as the politician. Right. Are you finished, Chair Henry? Councillor Dies.
Thank you, Chair, and through you to the Commissioner, thank you for the report.
And to your staff and your team, I know that you've worked very hard on all of these issues. And you've been very helpful to us on the homelessness issue in Ajax, and it's much appreciated. And I just wanted to know, I had a question on housing, and not-for-profit housing in our communities is very important. They're our only hope, really, at this point in time. And you know the waiting lists are extensive. How many not-for-profits do we have in Durham Region for housing?
Through the chair.
Just off the top of your head.
And 23, I believe, is the number I have in my mind. Yes.
So you may have had this conversation already, but I'm wondering if we have spoken to them about opportunities to grow their properties or intensify their properties. So we have Ajax Municipal Housing that has some larger lots because they're older properties, and many of them, I believe, are coming near the end of mortgage. So this might be the time to sort of plant the seeds and opportunities for ideas of how they can, perhaps get a loan from the bank and intensify on their property, and might be better off for that at the end of the day. So is that something we've considered?
Through the chair, I'll ask Director Robbins to respond because he does a lot of work with our nonprofits.
Yeah, thank you very much, and through the chair. Yeah, we're actively working with 2 nonprofits right now that are intensifying on their current sites. So that is something that is definitely being worked on across the nonprofit portfolio, and looking at funding opportunities, whether it's the Ontario Priorities Housing Initiative or the AHEP program. These funding programs are really the tools needed for these housing providers to use in addition to the federal co-investment fund, which provides some grant money, but the rest is lower interest loans. So it's the stacking of all of these benefits that allows them the opportunity to pursue those development activities. Right. And as I said, we have 2 right now which are currently actively involved in intensifying their current locations.
Okay, thank you. I'm hoping that increases because I think we need to really push this idea and maybe give them some ideas. Some may not be at that level where they have that those opportunities. So thank you.
I have no other speakers. Any further speakers? Seeing none. I do want to continue on the conversation just with around the whole issue, not along the crisis, but more along the messaging from Regional Council, from the region of Durham, and just the understanding of how we collectively can better message and work to have the attention to our communities. Because I'm going to tell you, in Whitby, a lot of people don't perceive homelessness as existing there. It's a continuous conversation. My next op-ed piece is about homelessness in Whitby to just educate our community as a whole, because it is there. It's very present, and we need to help to educate the community. That's the first part. But the second part is that of the 29,000 individuals that we subsidize, the potential of, one, where did they come from? Like, what was their situation? Was it a breakup of a home? Was it the fact that they're a senior? Is the understanding of that 29,000? Because I think that 29,000 is going to be a lot more in the next year. And I hear it every single day from my 28-year-old who's like, I'm never going to be able to afford a house. She makes $24 an hour. And even yesterday, my son sends me a text. I thought in university that 6 figures would enable me to have a good house, a good income, and not have to worry about what's taking place. But then at the federal level, we hear yesterday there's a talk of another quarter increase in the rates potentially coming up in the next 2 weeks. We hear from the grocers and that their response to the federal government and the price of what is taking place within the grocery stores, that it's really not the food that's making their profit. It's all the non-essential items that are in a grocery store. Tell me what's non-essential in a grocery store and help me to understand that. But I know that's not your answer or question for you to answer. But I think we have these roundtables taking place at AMO, at FCM, at Ontario Large City Mayors, that we're talking but the words aren't resulting out in action. And I don't know if there can be a solution that we create our own Durham solution to help become that model, because it is very frustrating each day when you have to deal with the same homeless person, or you have to deal with an issue of just even the complaints from the community about what is taking place. I think that there needs to be more of an action plan or a work plan that needs to be moved forward amongst ourselves as well. Is there any thoughts on that?
Through the chair. So you're speaking beyond the advocacy piece, outside of that. Certainly, we have our Health and Social Services Committee as our lead in this work. So there's opportunities for us to bring forth some ideas and suggestions for moving forward. I am bringing a report in May on homelessness, an update, and talk about our investments. And through that, it'll be good for us to highlight who these 29,000 are as well. That's a very good point for us to take that away and identify that to you.
Okay, and I appreciate that. Now, in terms of modernization and that discussion about modernization, the hurdles for the non-for-profits, and working with a lot of non-for-profits myself, some of it is actually the resources of the understanding of what they're able to do. They're limited with resources and limited with even the application process, and understanding how that application process can move forward and where their funding can eventually come from. So their whole business plan is a chance that they take, because that executive director may be there only for a short time period. And does that board want to take the chance for future boards or for future to make a big investment, such as taking on a bigger mortgage or even taking on a mortgage? I sit on the Denise House board, and that's been one of the biggest hurdles. And I even know with dealing with our co-op in Whitby, that's been the struggle. It's the understanding of being able to do that next step, to modernize, to grow, and how can we bring resources to help them?
Through the chair, the nonprofit sector is a very important sector, and I think in the past it's been somewhat ignored, and then COVID hit, and they lost staffing and funding like everybody else through their donations and fundraising efforts. So some of our discussion that we've been having is around how do we build capacity for them. So identifying, gaps, and is it through, in-kind staffing opportunities to go and support them, to help them look at their budgeting and look at their governance and things like that, to help them identify how better to serve their communities. Some also need to look at who is it that they need to serve. Like, what is the funding that they're getting for it? If you're focused on seniors, don't start focusing on youth, because your forte is seniors. And okay, there's some money out there, I'm going to apply for it, because they're in need of funding. So they opt in to any opportunity. So I think it's really helping them to understand their mandate.
The other is the silos that take place within our community, and the silos of where the servicing to our community is one that is believed by the non-for-profit, by the ministerial group, by the individual within the community, that they believe they are doing good, but yet with their silo of not having that crossover and understanding that there is a system, there is a mechanism. I think that's an education piece that needs to be built and enhanced as well too. And we saw that in the roundtable that we had in Whitby with the roundtable for the food banks. It's now bringing people together to know, hey, there's more out there that can be done, and you just don't have to do it within your four walls, that you can reach out and get that help as well too. I think that's something else that we need to be enhancing as well too.
I agree.
Okay. Thank you very much for the presentation. And we are now going to move on into our agenda. There are no delegations. We have no correspondence. And I'm going to move to the reports 2023 MOH2, standing agreement with Zoll Medical Canada Limited. Can I have a mover? Mayor Carter, second by Mayor Foster. Questions? Mayor Foster. Oh, actually, I had Mayor Carter.
Oh, no, I do apologize. I was going to move both budget items, so I'll stand down.
Mayor Foster, hit your button. Yeah, so I can, there you go.
I think it's easier just pushing it. I saw Commissioner Taylor this is a finance question. Well, I was going to ask Nicole instead, but Commissioner, thank you. Similar to a few years ago, we would see the problem children of budgets where things went over budget. Similar to that, we see only the sole source. And I do get somewhat concerned with us not going to market. And I understand why the recommendations are not to go to market. It's expedient. But can you talk to us just briefly about the rules around that? So supportive of this, but we only see these ones. We don't see the vast majority of contracts that actually go out.
So through the chair, there are actually a number of reporting mechanisms that come through the CIP, and that's where you will often see where there's been variances in awards from the time of award through perhaps change orders and the like. So there is a reporting mechanism there. There's a couple of different reporting mechanisms that are semi-annual relating to all of those different categories of things where the RFP is different. The funding needed once an RFP comes in is different than the budget. There's reporting mechanisms for consulting and how that has changed. There has been a lot of delegation of authority over the last number of years simply because the order of magnitude of what we do is so significant that we need to have those delegations in place to have business to carry on. The one thing I can reassure you of, though, if this helps, from the perspective simply of sole source, they are very heavily scrutinized because of a lot of the agreements we have in place. And we do track to make sure that the number of sole sources that happen annually are not trending in the wrong direction. So we do also pay attention to that. We have some internal dashboards that we look at to make sure that I'll say there's nobody going rampant with sole sources. We make sure that that they're consistent and so very, very supported in each time.
And yet another comforting answer today. Thank you. Thank you, Madam Chair.
Anything further? Seeing none, all in favor? And that's carried. Mayor Carter, you want to move both budgets? There
I
you go.
do.
I do.
Thank you very much. I was so excited. So I'd like to move the health budget as recommended, Madam Chair. And I'll move the second, the social services. If you wish.
First on the health budget, second by Mayor Foster. Any questions? All in favor? That is carried. Mover on the social services, Mayor Carter, seconded by Councillor Jubb. Questions? All in favor? And that's carried. And we have no further. Our next date is April 6th. Motion to adjourn. Chair Henry, seconded. Councillor Anderson, all in favor. And thank you, everyone, for all the work that you've done on this budget for 2023-2024. Now you can start working on the next one.